Now we have you to be looking at a lot of injuries that could actually occur to our fingers, you understand, and different ways in which our fingers could actually appear in these injuries. Do you understand? So of course this will help us to be able to now diagnose a whole lot of what issues that could occur to our fingers, right? So for this video yet, we are looking at what is known as the lumbrical plus finger. Lumbrical plus finger. All right. So you could see this. Just observe this finger, how it is actually, if you try to bend it, it's not really bending like the others. Do you understand? Sometimes it raises on its own. Observe this one too. You bend the rest, but this one is up, and you are trying your possible best to actually bend it. So what is a lumbrical plus finger? It's a rare but it's a fascinating hand condition. It causes what? A paradoxical movement. So when a person tries to flex their finger, all right, the interphalangeal joint, especially the distal ones, extend instead of flexing. Flexing is I'm bringing my fingers down, but they are refusing to come down. Okay, the finger is staying up. You get? So what goes on anatomically? The condition is usually caused by what? Disruption in the flexor digitorum profundus. All right, tendon which is distal to the origin of the lumbrical muscles. All right. So here is the chain reaction. Now the lumbricals usually originate from the flexor digitorum profundus. So if the flexor digitorum profundus is damaged or too long, all right, it pulls on the lumbricals. So the lumbricals then pull on the lateral bands of the extensor mechanism, So result, instead of flexing, the interphalangeal joint extend. Do you understand? Hence the plus effect. All right. So clinical signs, paradoxical extensions, right, most commonly affect the middle finger, but it can also affect this one too. Patients may notice one finger sticks out. Okay, so causes is due to flexor digitorum tendon lacerations, could be avulsions or amputation, any issue though, or maybe excessively long tendon grafts, middle phalanx amputations, repetitive trauma to the palm, anything, right? Diagnosis, you're actually looking at what is happening. You are telling the patient to flex, all right, and if problems are coming, you already know. So observations, if symptoms are mild, that's for treatment. Then tenodesis, so lumbrical release if the tendon is too retracted or non-functional. Okay, so that's it for the lumbrical plus finger.